that the increasing use of statin drugs is one of the reasons we're not having an epidemic of diabetes. Okay, so we're talking about statin drugs, and I mentioned before one of the ironic things is they're given to diabetics all the time because diabetics are, prone to get cardiovascular disease, and doctors have been convinced these drugs do what they don't do, which is prevent strokes and cardiovascular disease. More about that later. But doctors thinking that they do that often give them to diabetics, and guess what? It turns out that these drugs make diabetes worse. Not surprising, but they do. Here's an article that says randomized trials suggest moderate intensity statins increase type 2 diabetes risk by around 11%, with a potential further 12% if you go to the higher doses of the statin drugs, such that high-intensity statin drug can increase your risk of developing diabetes to 20% increased risk by taking a drug. If it did something, if its benefits outweighed the risk, I could see it, but as you'll see in a little bit, that's not the case. There's no benefit at all to these drugs. It's all risk. The researchers go on to say this data translates into one extra diabetes case for every 100 people who are taking statin drugs over the next 5 years. So they say we're having a diabetes epidemic, and, it's true. There are a lot of factors involved. This is one of them. The increasing use of statin drugs is one of the reasons we're not having an epidemic of diabetes.